Hello, thank you for inviting me to present. This presentation, I'm going to explore how harm reduction can support entire shelter communities, both people who use substances and those who don't. Inclusion strengthens safety, and dignity, and emotional stability across the whole environment. Now, a little bit about me. I bring over 35 years of senior leadership experience in business operations and strategy and public sector program development, including work with Toronto Community Housing. I have graduate training in business and psychology, plus social work, with a focus on trauma informed care, and 15 years of experience in casework and frontline program delivery with various organizations. So, harm reduction plays a vital role in reducing immediate risks for people who use substances. However, residents who don't use substances, they're often left out of the discussion. So recognizing their needs enhances the stability and effectiveness of harm reduction approaches. Inclusive practice supports all members of the shelter community. And here you can see some daily examples of harm reduction in other areas. So let's talk about the impact to the environment. Now, sometimes harm reduction is implemented in a way that looks outward rather than holistically. That means the whole system. Now, residents and staff may be exposed to substance use, paraphernalia, or medical crises in communal spaces, which can be distressing or triggering. And over time, these experiences can lead to anxiety, disrupted sleep, and an overall reduced sense of safety if supports and boundaries are not in place. So let's talk about why inclusion matters. Harm reduction is a modality within trauma informed care. It sits under trauma informed care, and trauma informed care must apply universally. It's one of the key tenets there. People who use substances are part of that community, and equitable harm reduction ensures that the safety and emotional well-being of all residents and staff are integrated into programming in general, and policy. So inclusive practice strengthens community stability. One of the key areas here is in judgment-free principles. So this perspective reflects inclusive harm reduction, collective care, and balanced implementation. So when harm reduction practices are structured, they're consistent and predictable. They support people who use substances while also reducing secondary trauma for those around them. A trauma-informed approach also recognizes when a setting is not equipped to meet someone's needs. If a person is experiencing repeated health crises, well, it may indicate that their current environment cannot offer the level of support, stability, or clinical resources that are required for them. It's not a good support. So responding with compassion, appropriate referrals, and a commitment to safe, effective care is essential. So let's talk about best practices. So a clear, accessible policy. It helps staff apply harm reduction practices consistently and gives residents a predictable understanding of expectations, predictability and clarity, reduce anxiety and emotional overwhelm, which supports psychological safety for everyone. So best practices are designated spaces as well. So where possible, designated consumption spaces, they reduce accidental exposure for residents who do not use substances, and they support safety and communal living areas. At the same time, they uphold the dignity and the rights of people who use substances by ensuring access to appropriate aligned spaces. So some of the best practices include trauma-informed staff training. So this trauma-informed practice. This training equips staff to respond to overdoses and crises without escalating fear among other residents. Recognizing that witnessing medical emergencies can be triggering, and it allows shelters to anticipate emotional responses and build mechanisms that support stability and psychological safety. So Here we have inclusive communication as a best practice. Inviting regular feedback from residents ensures that diverse needs are acknowledged and met. Transparent and inclusive communication helps tailor harm reduction strategies. It builds trust and reduces stigma across different resident groups. Rapid response and support. Now, after distressing events, immediate emotional support and debriefing helps prevent accumulated trauma. Here, of course, when we think about rapid response and support, it's not often about the environment, but this is the critical piece. So it's not only the individuals directly involved. So leaving people without support can compound trauma, and so interventions can be inclusive and responsive. And as we know, in a shelter setting, people come with trauma. So even those that are not using are very susceptible to this. So what is the role of harm reduction partners that we have that are very valuable? Well, in many shelter settings, harm reduction workers are primarily focused on supporting people who use substances. This work is critical, but it represents only one aspect of trauma-informed care. So to maintain a community-wide approach, shelters benefit from integrating additional clinical, social work, or mental health perspectives so that policies reflect the full range of resident needs. Collaborative practice ensures more balanced decision-making and reduces those gaps in support. So, in conclusion, inclusive harm reduction connects the needs of people who use substances with the equally important needs of those who do not. When policies and practices honor the safety, dignity, and emotional well-being of everyone, shelters become more stable, humane, and effective environments for all members of the community. Well, I look forward to your questions here. Thank you.